Hi everybody, I'm Dr. Jackie Hwang. You may call me Dr. Hwang. Today I'm very happy to be here and educate you guys about health education. In my mind, health education is very important because all we doctors want to deliver correct, proper information to our patient. Alright, let's move on to the next slide. Okay, what is health education in your guys' mind? Health education in my mind, in my thoughts, those are education which will provide people with knowledge, attitudes, skills, and experiences which are needed for healthy eating and physical activity. Alright, healthy eating, that is very important because everybody eats every day, okay? We want to deliver a good, proper education to people who will eat correctly. And also, movement, physical activities, those are important too. So a good health education will provide people with knowledge about what can eat and how to do correct exercise. Also, health education can provide people with opportunities to acquire useful knowledge, attitude, and skills. And those are necessary for making healthy decisions, achieving health literacy, adopting healthy behavior, and promoting the health of others. In other words, we are trying to make the patient who is sitting in front of you to become more healthy and also trying to let the people surrounded become more healthier. Wow, those are very important. If you deliver a good, a proper health education, not only you help the patient who is sitting in front of you, also you are trying to help the people who are surrounding the patient. And also, health education can increase the likelihood that people engaging in healthy behaviors and try to avoid, or let's say reduce, health risks. Health education assists people in living healthier lives. Okay, reduce or avoid health risks, those are also important because we try to deliver a proper education, and those education not only give them healthier behaviors but also can reduce the risk that they may encounter. So, what is a good and effective health education? Well, in my mind, those are good, effective health education need fundamental items. Let's look at item number 1. In my mind, I think an effective health education should focus on clear health goals, and those goals are related to behavioral outcomes. And the health education should be based on research and based on scientifically theory, which is provided by physician. Okay, and also we want to give proper, effective health education. Those are addresses to individual and group norms, value, attitudes, and beliefs. In other words, we want to deliver a proper health education to the group depending on their age, depending on their beliefs. Alright, we don't want to give them health education which is against their beliefs. If you do that, maybe they will have conflict inside of their mind and they won't follow you. So we need to provide age and culturally appropriate information, which is about learning strategy, and we need to teach them how to become more healthier and how to use proper materials to become more healthy. Okay, let's move on to the topics. Here I prepare 3 topics. I would like you guys to break into 3 groups and to perform a health education. Okay, let's look at topic number 1, which is about baby fever. Okay, baby fever is very commonly happen in almost all babies. Okay, and how to give the mom, the dad important, proper and correct health education is very crucial. First of all, we need to define what is a fever and how to lower the temperature when they are at home. And when they bring the baby to a pediatrician, what are the commonly oral medication a pediatrician will prescribe to the baby? We need to educate mom and dads. And what are the common anal suppository usage that pediatrician will provide to the baby? Because we all understand that when baby eats oral medication, it could be a little bit hard because they are small, they may move around, they don't want to eat. So anal suppository usage is very crucial. We need to teach the mom and dads how to use them. And also, if febrile convulsion occur, what can they do? Okay, those are very important those are very important health education we need to provide to our mom and dads. And let's look at topic number 2. That's about children diarrhea. Okay, what is a diarrhea? What is the definition of diarrhea? When we have stool passage every day, how do you define a normal stool passage to a diarrhea? Then we need to educate the mom and dads what are the causes of acute gastroenteritis. Usually we divide acute gastroenteritis into 2 groups. One is viral, second is bacteria. We need to educate mom and dads how to, let's not use the word differentiate, how to know the difference between the viral acute gastroenteritis and bacteria acute gastroenteritis. And also we need to educate the family members what can baby eat and what cannot baby eat. Okay, and when is a crucial important moment, we need to let the children, the baby, to admit it in hospital. Okay, those are the key items I would like you guys to educate mom and dads. Let's look at topic number 3. That's acne vulgaris. Acne vulgaris are usually we call pimples. Those usually occur in teenagers. Okay, and what are the definition of acne vulgaris? And what are the types of active acne? And I would like you guys to search a little bit more about acne scar. Also, you need to understand what is the contributing factors of acne vulgaris. We also need to educate the family what are the contributing factors. If you educate them correctly, they could block out the contributing factors so that they won't keep on continuing doing the bad behaviors. Okay, and then we need to educate the teenager and the mom and dad how to differentiate acne vulgaris to the other types of facial bumps. Okay, and what are the most common topical treatment and oral medications that they usually will encounter when the pediatrician prescribe to teenagers? Okay, above I prepare 3 topics. Let's break into groups and do our group project.